Hello everyone, my name is Rosana Santoro and today I will talk about cancer. What is cancer? Cancer is a disease in which some of the body cells grow uncontrollable and spread off to the other parts of the body. Cancer can start almost anywhere in the human body, which is made up of trillions of cells. Normally, human cells grow and multiply through a process called cell division to form new cells as the body needs them. When cells grow old or become damaged, they die and the new cells take their place. Sometimes this orderly process breaks down and the abnormal or damaged cells grow and multiply when they shouldn't. These cells may form tumors, which are lumps of tissue. Tumors can be cancerous or not cancerous, benign. Cancerous tumors spread into or invade nearby tissues when they can travel to distant places in the body to form new tumors, a process called metastasis. Cancerous tumors may also be called malignant tumors. Many cancers form solid tumors, but cancer of the blood, such as leukemia, generally do not. Benign tumors do not spread into or invade nearby tissues. When removed, benign tumors usually don't go back, whereas cancer tumors sometimes do. Benign tumors can sometimes be quite large, however. Some can cause serious symptoms or be life-threatening, such as benign tumors in the brain. What does cancer develop? Cancer is a genetic disease, that is caused by change to genes that control the way our cells function, especially how they grow and divide. Genetic change that cause cancer can happen because of errors that occur or cells divide, of damage to DNA caused by harmful substances in the environment, such as the chemical and tobacco smoking and ultraviolet rays from the sun, and they were inherited from our parents. The body normally eliminates cells with damaged DNA before they turn cancers, but the body's ability to do so goes down as we age. This is a part of the reason why there is the high risk of cancer later in life. Which person cancer has a unique combination of genetic changes. As the cancer continues to grow, additional changes will occur. Even within the same tumor, different cells may have different genetic changes. Which types of cancer? There are more than 100 types of cancer. Types of cancer are usually named for the organs or tissues where the cancers form. For example, lung cancer starts in the lung and the brain cancer starts in the brain. Cancer also may be described by the type of cell that formed them, such as epithelial cells and a squamous cell. We are some categories of cancer that begin in specific types of cell. Carcinoma. Carcinoma are the most common type of cancer. They are formed by epithelial cells, which are the cells that cover the inside and outside surfaces of the body. There are many types of epithelial cells, which often have a colon-like shape when viewed under microscope. Carcinomas that begin in different epithelial cells types have specific names. Adenocarcinoma is a cancer that forms in the epithelial cells that produce fluids or mucus. Tissue with the type of epithelial cell are sometimes called glandular tissue. Most cancers of the breast, colon, and the prostate are adenocarcinomas. Basal cell carcinoma is a cancer that begins in the lower or basal layer of the epidermis, which in a person outer layer of skin. Squamous cell carcinoma is a cancer that forms in squamous cells, which are epithelial cells that lie just beneath the outer surface of the skin. Squamous cells also line many other organs, including the stomach, intestine, lungs, bladder, and kidneys. Squamous cells look flat like fish scales when viewed under a microscope. Squamous cell carcinomas are sometimes called epidermal carcinomas. Transitional cell carcinoma is a cancer that forms in the type of epithelial tissue called transitional epithelium or urothelium. This tissue, which is made up of many layers of epithelial cells that can get bigger and smaller, is found in the lining of the bladders, ureters, and the part of the kidneys, and a few other organs. Some cancers of the bladder, ureters, and the kidneys are transitional cell carcinomas. Sarcoma. Sarcoma are cancers that form in bone and soft tissues, including muscles, fat, blood vessels, lymph vessels, and fibrous tissue. Osteosarcoma is the most common cancer of bone. The most common types of the soft tissue sarcoma are leiomyosarcoma, Kaposi sarcoma, malignant fibrous histiocytoma, liposarcoma, and dermatofibrosarcoma protuberans. Leukemia, cancer that begins in the blood-forming tissue of the bone marrow are called leukemia. These cancers do not form solid tumors. Instead, large numbers of abnormal white blood cells build up in the blood and the bone marrow, count out normal blood cells. The low level of normal blood cells can make it harder for the body to get oxygen to its tissues, control bleeding, or fight infections. There are four common types of leukemia, which are grouped based on how quickly the disease gets worse and the type of blood cells the cancer starts in. Acute forms of leukemia grow quickly and the chronic forms grow more slowly. Lymphoma. Lymphoma is cancer that begins in lymphocytes, T cells, or B cells. These are disease-defined white blood cells that are part of the immune system. In lymphoma, abnormal lymphocytes build up in lymph nodes and the lymph vessels, as well as in other organs of the body. There are two main types of lymphoma. Hodgkin lymphoma. People with these diseases have abdominal lymphocytes that are called Reed-Steinberg cells. These are usually formed from B cells. No-Hodgkin lymphoma. This is a large group of cancer that starts in lymphocytes. The cancer can grow quickly or slowly, and it can form from B cells or T cells. Multiple myeloma. Multiple myeloma is a cancer that begins in plasma cells, another type of immune cell. The abdominal plasma cells, called myeloma cells, build up in the bone marrow and they form tumors in the bones all through the body. Multiple myeloma is also called the plasma cell myeloma and the Kettler disease. Melanoma. Melanoma is a cancer that begins in cells that become melanocytes, which are specialized cells that make melanin. Most melanomas form on the skin, but melanomas can also form in other pigment tissues, such as the eye. Brain and spinal cord tumors. There are different types of brain and spinal cord tumors. These tumors are named based on the type of the cell in which they formed and where the tumor first formed in the central nervous system. For example, an astrocyte tumor begins in star-shaped brain cells called astrocytes, which help keep nerve cells healthy. Brain tumors can be benign, not cancer, or malignant cancer. Symptoms of cancer. Cancer can cause many symptoms, but these symptoms are most often caused by illness, injury, benign tumors, or other problems. If you have symptoms that do not get better after a few weeks, see your doctor so that problems can be diagnosed and treated as early as possible. Often cancer does not cause pain, so do not wait to feel pain before seeing a doctor. Some of the symptoms that cancer may cause include lump or firm feeling in your breast or under your arm, nipple changes or discharge, skin that is itchy, red, scaly, dimpled, or puck red, pain when urinating, blood in the urinate, blood in the stools, change in the bowel habits, trouble swallowing, belly pain, nose and vomiting, appetite change, headaches, seizures, vision change, hearing change, drooping of the face, and another. How cancer is diagnosed. If you have a symptom or a screening test result that suggests cancer, your doctor must find out whether it is due to cancer or some other cause. The doctor may start by asking about your personal and family medical history and do a physical exam. The doctor also may order lab tests, imaging tests, scans, or other tests or procedures. You may also need a biopsy, which is often the only way to tell for sure if you have cancer. Types of cancer treatment. There are many types of cancer treatment. The types of treatment that you receive will depend on the type of the cancer you have and how advanced it is. Some people with cancer will have only one treatment, but most people have a combination of treatments, such as surgery with chemotherapy and radiation therapy. When you need treatment for cancer, you have a lot to learn and think about. It is normal to feel overwhelmed and confused, but talking with your doctor and learning about the types of treatment you may have can help you feel more in control. Some examples for treatment. Biomarker testing for cancer treatment. Biomarker testing is a way to look for genes, proteins, and other substances that can provide information about cancer. Biomarker testing can help you and your doctor choose a cancer treatment. Chemotherapy. Chemotherapy is a type of cancer treatment that uses drugs to kill cancer cells. Learning how chemotherapy works against cancer, why the causes and effects, and how this is used with other cancer treatments. Hormone therapy. Hormone therapy is a treatment that slows or stops the growth of the breast and the prostate cancer that use hormones to grow. Learning about the types of hormone therapy and the side effects that may happen. Hyperthermia. Hyperthermia. Hyperthermia is a type of a treatment in which body tissue is heated to a high as 113 Fahrenheit to help damage and kill cancer cells with a little or no harm to normal tissue. Learning about the types of cancer and the precancers that hyperthermia is used to treat, how it's the give and the benefits and the drawbacks of using hyperthermia. Immunotherapy. Immunotherapy is a type of cancer treatment that helps your immune system fight cancer. This page covers the types of immunotherapy, how is it used against cancer, and what you can expect during treatment. Photodynamic therapy. Photodynamic therapy uses a drug activated to light to kill cancer and the other abnormal cells. Learning how photodynamic therapy works, about the types of cancer and the precancer it's used to treat, and the benefits and the drawbacks of the treatment. Radiation therapy. Radiation therapy is a type of cancer treatment that uses high doses of radiation to kill cancer cells and shrink tumors. Learn about the types of radiation, why side effects happen, which side effects and you might have, and more. Stem cell transplant. Stem cell transplants are producers that restore stem cells that grow into blood cells in people who have had theirs destroyed by very high doses of chemotherapy or radiation therapy. Learn about the types of transplants, side effects that may occur, and how stem cell transplants are used in cancer treatment. Surgery. When used to treat cancer, surgery is a procedure in which a surgeon removes cancer from your body. Learn the different ways the surgeon is used against cancer and what you can expect before, during, and after surgery. Target therapy. Target therapy is a type of cancer treatment that targets the change in cancer cells and help them grow, divide, and spread. Learning how target therapy works against cancer and about common side effects that may occur. Side effects of cancer treatment. Cancer treatment and the cancer can cause side effects. Side effects are problems that occur when treatment affects healthy tissues or organs. Speak up about any problems you have. Your healthcare team can treat and or talk with you about ways to reduce these side effects so you feel better. Some side effects listed here: anemia, appetite loss, bleeding or bruising, constipation, delirium, diarrhea, fatigue, hair loss, infection and neutropenia, memory or concentration problems, nausea and vomiting, nerve problems, immunotherapy, inflammation, and pain. How to find the cancer resources you can trust. Online resources of cancer and other health information should make it easier for people to know who is responsible for posting the information. They must make it clear the original source of information along with the medical credentials of the people preparing or reviewing the posted material. Here, material. Here are two places with reliable sources. Number one, cancer treatment schemes. A page from the Federal Trade Commission's FTC advises people to ask their healthcare provider about the products and the claim to cure or treat cancer and offers types for spotting treatment scans. Number two, evaluate cancer information on the Internet is the disclaimer, developed by the American Society of Clinical Oncology, ASCO Cancer. Net provides information including common misconceptions about the cancer and the types to evaluate the credibility of online cancer information. Together, we can change the discourse of cancer, creating a better world with the hope of a healthy life. Thank you.